My name's Ryan Miley. I'm a family physician here in Saskatoon. I have a number of patients who are on the SED program who I am very concerned that their housing situation and as a result their health will be drastically affected by this cut. And I'm concerned from that point of view as a physician worried about my patient, also as somebody who's been advocating for a better approach to poverty in Saskatchewan. A couple of years ago, Upstream, an organization I'm involved with, and the Anti-Poverty Coalition, Food Bank, and Health Region put on a campaign that we called Poverty Costs. We put on that campaign to try to tell the story of poverty in Saskatchewan and move us towards having a proper strategy to reduce the amount of people who are living in poverty in our province. So we started by crunching the numbers, told the story of the real cost of poverty, $3.8 billion every year to the Saskatchewan economy because of the increased health, social services, and economic losses that result from having nearly 10% of the population living in poverty. But then we told a different kind of story. We worked with people living in poverty to share their struggles, the way that their interactions with the social service system and just having not enough money for basic needs impacted their health and their quality of life. And people listened to those stories. People across the province got excited and advocated on their own for a poverty reduction strategy. And even the government listened. Premier Brad Wall came out and said that they would have a poverty reduction strategy, and even asked me and other community members that were involved with the Poverty Cost campaign to help inform what would go into that strategy. So we recommended, after months of work working with people inside government and in the community, we recommended a number of changes to income supports, to early childhood development, to housing, to food security, things that would make a real difference and allow us to drop poverty in this province by 50% within 5 years. And then the government came back with something not quite as strong, but still some points that they were going to take forward as a strategy of their own. So imagine our surprise this summer when, rather than hear about any improvements in income supports, any advances in taking care of people, rather we hear about serious cuts to housing and income supports for people with disabilities.
Where are we supposed to go? There's not enough affordable housing. In this country, there has to be equal justice for the disabled. And we need to continue to fight because this is not the end.
When economic times are tough, it's tempting for governments to cut social services, social spending, but that's the worst time. When times are tough, you need to invest more in people. That's how you save in the long run. That's how you keep people healthy and improve our lives. The last thing we should be doing right now is trying to balance the economy on the backs of the most vulnerable.